Finally, the basic posterior exam involves evaluation of the internal posterior components of the eye, such as the vitreous, optic discs, retinal vessels, and retina. In the clinic, this component of the examination is performed with the use of a slit lamp microscope or a magnifying headlamp with a light source combined with the use of additional lenses. However, this can also be accomplished at the bedside or in any patient examination room with the aid of an important examination tool called a direct ophthalmoscope. We want you to feel comfortable using the direct ophthalmoscope for the posterior exam, and will provide you with instruction and important pearls to accomplish this.
We will now perform the posterior segment examination. This can be somewhat challenging at bedside or in the clinic. Unlike when we're in the eye center, we often have the patient seated in a nice exam chair and we have the pupil pharmacologically dilated. You unfortunately won't have that luxury. So it's very important to try to position the patient as best you can, typically in a sitting up position, and also try to be at the same level as the patient to optimize your visualization of the posterior segment. Also, it's very important to realize that when you're going to be looking at the back of the eye, you'll be using a direct ophthalmoscope. And because the patient will not be pharmacologically dilated, you want to use the smallest light diameter as possible. Any light diameter that is very large can cause light reflexes that come off of the edge of the pupil that can again make visualization of the posterior segment very difficult. So what I'd like to do is I'll have Dr. Zhao look straight ahead, and I'll begin by, and if the patient is wearing glasses, we ask them to take the glasses off. If you, as the examiner, are wearing glasses, you certainly can keep them on, or you can take them off and actually put your refractive error right into the direct ophthalmoscope. So once I've had Dr. Zhao look straight ahead, I will begin my examination by first looking at the red reflex from about an arm length away. And if you don't see a very good red reflex, this could be due to either an opacity of the cornea, an abnormality of the anterior chamber, possibly an opacity of the lens, such as a cataract, or possibly even vitreous pathology, whether it be a vitreous hemorrhage or some inflammation in the vitreous. But it's very important to be able to determine if there is a good red reflex, and if there is, that gives you a very good chance of being able to visualize the posterior segment. I'll also like to ask Dr. Zhao if it's okay if I put my hand on your head. And this is very helpful because when I start from a position back here and I work my way forward, I don't want to inadvertently have my head hit her head. It's also very important to remember that when you're examining a patient's right eye, for example, as I'm doing with Dr. Zhao, that I use my right eye as well. If I were to examine her with my left eye, and as I got closer to her, it would become a very awkward position. So right eye, examining the patient's right eye, my left eye, examining the patient's left eye. Very good. So Dr. Zhao, please look straight ahead. I will then begin by looking for the red reflex. Once I've found it, I will work my way in, and I will first try to visualize the optic nerve. And the optic nerve is going to be located just slightly nasal to the center axis of the vision. And once I locate the optic nerve, I'm looking at the color of the optic nerve to determine whether it's a orangey pink color. If there's any pallor, that could indicate an optic nerve problem. I'm also looking at the margins of the optic nerve. They should be clean and distinct. If they're indistinct or blurred, that could be evidence of optic nerve edema, possibly papilledema. I'll also be looking at the cup, the center portion of the optic nerve. And normally the cup to disc ratio, the disc being the complete optic nerve head, should be about a 0.3. If it's any larger than that, that might indicate glaucoma. Once I've looked at the optic nerve, then I will look at the retinal vessels. And I'm looking at the caliber of the vessels to see if there's any AV nicking, to see if there's any narrowing of the blood vessels, to see if there's any plaques. I'll follow the blood vessels as far periphery as I can go. Once I've looked at all the retinal vessels, then I'll ask Dr. Zhao to look right at my light. And at that point, I'll be looking right at the macula, and I'm looking to see if I see any drusen, hemorrhages, or any other abnormalities. For example, if this is a patient with diabetes, you might see some yellow exudates or cotton wool spots indicating diabetic retinopathy. Very good, Dr. Zhao. Completely normal examination. Thank you very much.